you for joining today's NeedyMeds Brief, HEALfundr. My name is Carla, and I am the Education Coordinator here at NeedyMeds. And before we get started with the webinar, I'm going to go over just a few housekeeping tips. You can type your questions into the questions section of your GoToWebinar control panel, but keep in mind we will reserve answering questions until the end of the webinar. If we don't have time to get to your question, of course, we'll follow up with you personally via email after the webinar, probably by tomorrow afternoon. This webinar is being recorded, and it will be available at a later time for viewing on the NeedyMeds YouTube channel. Of course, we'll also email you a copy of the PowerPoint presentations after the webinar. So for many of you that are joining us, you know who NeedyMeds is and what we do. But for those of you that are new to us, NeedyMeds is a national nonprofit organization dedicated to educating and empowering those seeking affordable health care. And that's right on the PowerPoint slide because that is our mission. And we achieve that mission three ways. We do it by providing information on healthcare programs, by offering direct assistance, and by facilitating programs or projects. And we do this all via our website and toll-free helpline. And today, we're going to spend some time explaining in detail one of the projects that we began here at NeedyMeds, HEALfundr. It is my pleasure to introduce our webinar host for today, Evan O'Connor. Evan is the HEALfundr project manager, and he is going to walk you through how this crowdfunding platform works and hopefully how it can help you, your family, or your loved ones raise much needed funds for medical expenses. So if you bear with us just a moment, I'm going to switch the PowerPoint to Evan's presentation and pass him the mic. Thank you again.
Thank you, Carla. Hello, everyone, and thank you for taking the time to learn about NeedyMeds' unique crowdfunding platform, HEALfundr. Our mission at NeedyMeds has always been to help people facing problems paying for medications and healthcare, and the rise of crowdfunding has helped a lot of the doors for those in need. Crowdfunding has opened a lot of doors for those in need. For those unfamiliar, you may be asking, what is crowdfunding? Crowdfunding refers to the practice of collecting many small donations towards a larger single goal. Kickstarter is what comes to mind for most people when discussing crowdfunding, a site that helps people fund creative projects. Kickstarter projects offer rewards for pledged donations, most often a copy of whatever creative work is being funded, be it a film, musical record, what have you. However, there are other platforms that are used for charitable organizations or human interest campaigns, anything from recovering from natural disaster or personal tragedy to funding honeymoons. Since 2008, over $100 million has been raised through charitable crowdfunding. There are now over 500 different crowdfunding platforms covering everything from creative works, charitable organizations, and even equity investments. With so many different platforms already available in the online marketplace, why have we developed yet another? HEALfundr is unique in several ways, taking what we feel is the next logical step in crowdfunding for medical expenses. We verify 100% of our campaigns, something not offered by any other crowdfunding platform local to the United States. Other crowdfunding platforms are self-policing, in essence allowing the users to flag fraudulent or inappropriate campaigns. We take the guesswork out of whether a need is legitimate, so donors don't need to worry about losing money to deception. Funds collected through HEALfundr are paid directly towards medical expenses. Other crowdfunding platforms send the money directly to the campaigner. Most platforms state in their terms of use that they are not liable for any misuse of donated funds, as once the money is in the hands of the campaigner or beneficiary, there is no guarantee the money will be spent as described in the campaigns. With HEALfundr, every dollar raised is used to pay bills directly, so there is never any question of whether the money is getting to where it's needed. Funds exceeding the financial goal are designated by the donor to go one of 5 different ways. 1, they go to the beneficiary as cash. 2, the donor receives a prorated refund. 3, donor receives credit usable on HEALfundr to donate to another campaign of their choosing. 4, the money gets split between campaigns fighting a specific diagnosis or supporting patients in an affected area. Or 5, donate the remaining funds to NeedyMeds. Other crowdfunding platforms that allow for a goal to be surpassed send the money to the campaigner, who again is under no obligation to spend the money a certain way. And of course, all HEALfundr users will have access to NeedyMeds information and resources. Our aim is to give everyone who needs it the power to heal. Medical bills are the leading cause of bankruptcy in the United States. Lack of funds can prevent people from seeking out a doctor or buying prescribed medications or skipping doses, leading to potentially worse financial and health problems if their condition worsens. According to a 2015 survey, over half of American adults say they wouldn't be able to afford $1,000 in an event of a medical emergency. It's with all of this in mind that we have decided to give the power to you. You can harness the power to heal yourself by raising money through your own campaign, or you can use that power to heal others with the power and scope of the internet. Here's where we'll walk you through the basics of how HEALfundr works and how you can take control of that power. Creating a campaign is the first step to utilizing the power to heal. Anyone in the U.S. or its territories with legitimate medical expenses can sign up to apply for a campaign. In the interest of helping as many people as we can, we don't put any limits on the insurance status or income level. Anyone in need can apply. To verify campaigns, we require a letter from a diagnosing or attending doctor. In case we have questions, we ask for a release form allowing the doctor to discuss the patient's health care with us at NeedyMeds. This extra step ensures no funds will be misappropriated or used fraudulently. Nonprofit organizations, medical facilities, and medical research teams can also apply for a campaign to support a community stricken with a medical condition, purchase medical equipment, or other related costs. Your campaign page is where you will tell your story, post pictures, and share updates on your treatment with those that helps make it all possible. Donors can leave words of encouragement at the time of their donation and see how much of their goal is funded. This is where you'll be able to direct your friends and family on social media and the link they'll share to spread the reach of your campaign. Medical bills requiring payment need to be uploaded using the HEALfundr website, where they will be approved and paid for with the crowd-raised funds. The beneficiary only receives direct funds as designated by the donors if the financial goal is exceeded. Bills will only be able to be paid when the campaign has raised enough funds to cover the cost. We will coordinate with the beneficiary and their service providers to determine the order in which bills are paid. Campaigns can be held in many situations. Individuals can use HEALfundr to help cover unpaid medical expenses, purchasing durable medical equipment such as wheelchairs or other assistive equipment, or financially help those with chronic conditions or experiencing a medical emergency for which they're not prepared. Our mission is to simply help as many as we can. Any and all medical expenses are applicable, and anyone in the U.S. and its territories is eligible to apply for a campaign. Organizations can also raise funds on HEALfundr. For example, a nonprofit could fund a charity golf tournament to support a local community suffering from a specific condition, or a clinic or hospital could fund an MRI or other needed equipment. Donors can even have a hand in funding researchers developing new treatments for diseases. Donating to HEALfundr campaigns is quick and easy. Donations can be made with the credit or debit cards on HEALfundr, processed by authorized.net, or by mailing a check to NeedyMeds with the printed payment slip. Donations made by credit card are subject to a small processing fee through authorized.net, as well as a sliding scale administrative fee from HEALfundr. Check donations will not be charged a processing fee. Managing your campaign is also efficiently done through the HEALfundr site. Here is where you will submit medical bills for payment, as well as upload any additional supporting documents needed for approval. It's also where you will write and post updates on your treatment and the campaign as a whole right to your campaign page. Donors who have selected to stay updated will receive the update in an email. You'll be able to change or add photos shown on your campaign page. And lastly, you'll be able to see a complete list of your donors, their comments, donations, and an option to send a personalized thank you letter. We at HEALfundr will adjust the financial goal to cover the cost of all medically relevant bills and all associated fees. HEALfundr has experienced a lot of success since launching in 2014. We've had over 500 users sign up for HEALfundr, as well as receive an average of 500 visitors per day. Users have raised over $19,000 with HEALfundr, and patients ranging in age from 6 to 65 have had medical bills paid directly with donations. As you can see, HEALfundr is truly unique in the realm of crowdfunding in several ways. We are the only US-based crowdfunding platform to verify 100% of our campaigns to protect our donors from being deceived by fraud. Crowd-collected funds will be paid directly to service providers to cover bills, whereas other platforms send the funds to the campaigner, who at times isn't even the person in need. Due to our nonprofit status and low overhead, we apply a sliding scale of fees to donations: 5% for the first $20,000, 3% for the next $30,000, and 1% in all remaining funds collected. Under no circumstance will campaigners ever pay any fees out of pocket. We will adjust the financial goal to cover the cost of all care and fees. Other crowdfunding platforms apply a flat fee to all donations, usually between 4 and 12%. It is up to the campaigner to set their goal, keeping in mind all of the associated fees. HEALfundr donors designate a use for funds that may exceed the financial goal of the campaign, where other platforms send all funds to the campaigner who may not have a plan or obligation to spend the extra funds in any way. With over 19 years of connecting people with patient assistance programs, medical bill mediation, and discounts on prescriptions, we at NeedyMeds have an ever-growing database of resources that can further assist users and even lower the campaign goal. As a NeedyMeds project, HEALfundr is entirely owned and operated by NeedyMeds and its employees. We at NeedyMeds hold ourselves to a higher standard of attention and care, and are more than happy to spend extra time with a user coordinating their campaign or need help navigating the site over the phone. We will share campaigns on our own social media pages, but the largest impact will come from the campaigner and the beneficiaries' networks. The NeedyMeds helpline is also available for all users, potentially connecting the user to more resources to help cover medical expenses. Users also have access to the free NeedyMeds drug discount card, saving those without insurance up to 80% on anything prescribed by a doctor. I want to thank everyone for attending today for this brief presentation, and I hope we've been informative and ultimately are able to help a lot of people with HEALfundr. We are accepting applications and donations to several patients on HEALfundr now. If you or someone you know is in need and interested in using the platform, or if you have any additional questions, you can go to the site at www.healfundr.org or contact me directly. I am Project Manager Evan O'Connor. I can be reached at evan@needymeds.org or by phone at 978-865-4646. Thank you again, everyone, for attending this brief presentation. I will hand it back to Carla. Thank you again.
Good afternoon, everybody. Thanks again. This is Carla, extending, as Evan did, a thank you for joining us today, and reminding you that there are a few moments if you'd like to submit some questions. You can do so by typing them into the question section of your GoToWebinar control panel. We'll give you just a few moments for that. And again, if we don't have time to get to your questions, we'll follow up with you after. Or if you think of something when the webinar is over, you can contact Evan at evan@needymeds.org. So it looks like we have one question that came in, which is whether or not donations, the question, I'll read it as it came in, are donations tax deductible for the donor? And that's a really important question. I'll pass the mic to Evan so he can answer that for you.
That is a great question, and that's a question I probably should have included in the presentation because we do get it sometimes. Donations typically are not tax deductible. As we are not tax professionals, we can't give tax advice, but the typical rule is that if a donation is directed towards an individual, that it will not be deductible. However, with the way that we can split up excess funds that have surpassed the financial goal, if you decide to donate the remaining funds either to NeedyMeds as an organization or to a group affected by in an affected area or under a certain diagnosis. There are situations where those would be tax deductible. Again, we suggest anyone looking into these issues to contact a tax professional in your area because the laws are different throughout the United States. It looks like that may be our only question today. It was a great question. Thank you for asking. It looks like just since we're not getting anything else, I just wanted to say again, if you have any other further questions, feel free to email and ask, and we'll get back to you as soon as we can. The slides will be sent to the people who have attended if you need. And thank you very much for attending today's presentation. I've been Evan O'Connor. Thank you, Carla. And thank you very much.